Good morning, everyone. This is Megan Fournier with the Home Care Alliance Massachusetts. Thank you for those who were able to call in today for our presentation with Vikor Scientific. I'm here with Adam Holden, who will be our presenter today, and I'm just going to go over a couple of logistics before we begin. First thing is everyone's going to stay in mute only just for the sake of outside distractions. We will answer questions, but we'll save them to the end. So if you have questions, you can type it in at any point in time. You can find that into the questions tab, which is on the control panel. You can type it in there at any point in time, including if you have any audio issues or anything of that sort. I'll be here monitoring that. This is also being recorded, so for some reason, if you're having issues or you want someone else to listen to this, it will be made available once it's in process, so you'll most likely get this later today. You should have received the handouts. If not, you can also find the handouts in the handouts tab of the control panel, and I'll also resend them out with the recording. So I believe that's all I have on my end at this point in time. So I'm going to hand it over to Adam to run the presentation.
Oh, thank you, Megan, for the introduction. Again, my name is Adam Holden with Vikor Scientific. We also have Gina McBride on the call. She's one of the other senior territory managers with Vikor Scientific. And Jamie Ryan, one of our area vice presidents, may be joining in as well. I do know he had another call as well, but hopefully he'll get a chance to join us. But so we will get started. So let me just start the slideshow here. So just kind of give you a little overview of who Vikor Scientific Core Gene is. So we are a CAP-accredited, CLIA-certified molecular testing laboratory, and we focus on developing solutions to improve clinical economic outcomes. We offer multiple testing panels that include Respira ID, Urine ID, Wound ID, all with 99.8% accuracy. We use Thermo Fisher QuantStudio equipment. We were given clearance on March 23rd to add COVID-19 to our full respiratory panel of 40 pathogens and viruses called Respira ID. We'll be conducting via the QuantStudio 12 Flex Open Array. If anyone wants to do a real deep dive on the clinical, what type of tests we're doing, we have plenty of information. But basically, it is a market leader instrument for PCR testing. It has the capacity for high throughput, which allows us to test a high volume of patients or residents every day. So in an effort to protect our most vulnerable population, Vikor Scientific has prioritized offering Respira ID with COVID-19 to assisted living, memory care, long-term care facilities, and our traveling providers. Because obviously working with the assisted living facilities, memory care, we work with a lot of traveling care groups and home care groups, because many of these residents or patients obviously are either at a facility or at home. So our panels are covered by Medicare, Medicaid, and we have one of the most compassionate billing policies on the market for our panels for commercial insurance. Our reports provide quantitative pathogen results within 24 to 48 hours, and results are delivered via fax and web portal. And all our sample testing is all swab-based and is not limited by time, temperature, or any medications the patient is currently taking. So obviously, I know our most urgent pathogen to discuss is COVID-19, but we are a company that has a total of 6 different panels at our disposal. And the nice thing is all of these, so for the Respira ID is just a nasopharyngeal swab, or you can swab expectorated sputum, or you can do a throat swab. Temperature is not an issue, meaning it can sit overnight. Nothing needs to be refrigerated because this is all PCR DNA technology. And it does not matter what antibiotics or medications a patient or resident is currently taking. So these are the kits. So obviously I don't think anyone on the call has seen our kits before, as far as I know. But these are our Respira ID kits. So what's kind of unique about these is we always pre-package them. And this is really great for obviously traveling groups, home care groups, because when you receive your kits in a box, each individual kit for each patient is all pre-packaged in the specimen bag. You have the swab, the requisitions, all the paperwork is in there, and then we put the label on the front of the bag with which test it is and how to collect. So this presentation is kind of geared towards obviously tell you a little bit about Vikor, who we are, what we do, but also this can be used as a virtual kind of implementation or in-service on how to fill our paperwork. Obviously, we are living in a virtual world right now, and particularly for the traveling groups kind of who are all spread out, this presentation can be used to kind of train people on how to fill out the paperwork, because it's very important, because if the paperwork is not filled out correctly, unfortunately, it can delay turnaround time. So this is our sample Respira ID requisition, and it just kind of walks through the process of how to fill everything out. The important stuff on here really for everyone on this call is probably looking to see what we test for on our Respira ID. As you'll see, it's 40 pathogens made up of viruses, bacteria, and fungus. You will see COVID-19 on there. We do have the ability, if it is an employee of an agency or of a facility, to do COVID-19 only. However, if it's for a patient or resident, or our company really strongly feels running the full pathogen test for these residents, because as we know, or for these patients, because as we know, co-infections, underlying health conditions are kind of one of the major causes of serious illness, hospitalization, and death. So you'll see on here, we do staph, we do strep, pseudomonas, klebsiella, haemophilus influenzae, all the flu viruses. We've been testing for the other coronavirus strands for almost 2 years now, and we just added COVID-19. So we are currently not doing the antibiotic resistance genes for our Respira, because that is a reflex test based on pathogens present. So right now we're just kind of temporarily putting that on hold to maintain our rapid turnaround time, because even though this does add only about a half a day, our main goal is to get the results for this type of stuff right away. We do need an ICD-10 code, for the diagnosis. And then additionally, this is very important for all of our tests, we do need a medical provider signature on the requisition. So it does have to be an NPI provider, and that can be a PA, nurse practitioner, doctor, DO, whatever it is, but on all our requisitions, we do need a provider signature. This is just kind of the second page of the requisition, talks about, getting all the patient demographics, all that kind of stuff, but we don't really need to focus on that. So this is what our swabs look like. 2 patient identifiers always do need to be on the swab. We provide instructions for you, basically just an instruction package on everything that's in the kit, how to collect a nasopharyngeal swab, put the tube back in the swab, or put the swab back in the tube, excuse me, 2 identifiers, and then there's also patient testing information in the kits. So all of this paperwork right here, this is in every single testing kit that we send out. Talks about accuracy, talks about the turnaround time, talks about antibiotic resistance, but then billing is obviously very important. So it kind of mentions right up front to all our patients, this test is covered by most federal and commercial payers when medical necessity is met. However, we realize many commercial plans carry high deductibles, and this can lead to financial stress. And then this is really big. While Vikor will follow all rules and regulations, we do have a very compassionate billing policy. We will not send you to a collections agency. So no matter what, we will not send a patient or employee to a collections agency. And as far as I know, we're one of the few companies that puts that in writing up front. If they get an EOB or get a statement, they can call a number. And our kind of company motto is the only unhappy patient we will ever have is the one who doesn't take the time to call the number. We also have some fact sheets for patients. These are directly from Thermo Fisher's website. Kind of talks about what the test is. This test was authorized through the emergency usage authorization by the FDA, and kind of does a little deeper dive on that. So we do provide FedEx supplies for all our partners. So when the supplies come with the testing kits, you'll get the large clinical packs and you'll get FedEx labels. We do ask that anyone using a Vikor test does write down the tracking number, because obviously we want to make sure that we get, if for whatever reason we haven't had it happen yet, at least I have not had it happen yet, where supplies didn't show up, but everything is held at a hold station near our lab. I should mention our lab is we have one in Charleston, and now our second laboratory is in Philadelphia, but everything is sent priority overnight. So obviously one of the big questions, for being, obviously the home care company, is how to get us the swab. So because we send you everything you need to, you can either call FedEx and schedule a pickup, which you can do right from your house. You can have it picked up from your house or wherever the patient's house is. Sometimes the easiest way, right, though, is a FedEx drop-in. Right now, FedEx cannot accept clinical packs inside a FedEx store due to COVID-19. So we provide, little things. We provide cheat sheets and the quickest way to call FedEx. I know it seems kind of basic, but there are some little, things you can do to make sure it gets picked up quickly and get someone on the phone a little quicker than normal. There's obviously FedEx has a bunch of ways that you can find the drop-ins. You'll kind of see in this little area right here how many drop-ins are, but you can just find them and just do a drive-through drop-in, drop it in there. Typically on the East Coast, as long as it gets in there by 6 or 7 p.m., we will get it the next day, and we will report it within 24 to 48 hours of the day we receive it. We provide FedEx tracking logs. Now, in terms of getting your reports, we always fax the results to the number provided, and we also have a web portal. This web portal can be accessed through any computer. It's all just web-based. All you need is an email address, and we can send you a link to set up your Ovation portal, and all your results will be in the portal. We provide step-by-step instructions on how to access your results, and this is the website that you go to for your results. So here's one of our sample Respira ID reports. So as you'll see, kind of it's laid out very nicely. In the top left corner here, we have the pathogens detected. So we do two quick things. We only report what is clinically significant. How PCR technology works, or polymerase chain reaction, is it's all done by cycles. We stop our cycles at 40 cycles because we only want to report what's clinically significant. So we'll tell you what pathogens were detected and also the pathogen level. We do the percentage and we break it down as high, medium, or low. Again, we have put on hold the resistance genes detected. Then also we do employ doctors of pharmacy, PharmDs. This is very helpful, particularly for traveling groups, as if you have any questions about the pathogens detected and treatment options, you can email or call, and someone will get back with you and kind of talk about all the different treatment options, and there'll be an actual PharmD who gets back in touch with you. So again, on all our other panels, I'll show you some sample reports here in a minute. We actually put the pharmacy guidance on the report, but again, for Respira ID right now, because we're doing COVID, we're not putting it on there just to report this as quick as possible, and then we can follow up with pharmacy guidance. Here are our sample COVID-19 test sample results. So it's very, very clear. COVID-19, this is SARS-CoV-2 2019, the description of the test and the results. We are doing the 3-gene assay. And then if you want to do even a more deeper dive about the clinical test, there's a bunch of information at the bottom that talks about kind of the technical stuff of the test. So if any of our providers or nurses or anybody that wants some additional information about us, or questions about our test, obviously you can reach out to myself, reach out to Gina. But we do have the Dr. Bill Massey is our Chief Scientific Officer. Here's some background on him. We can also provide letters to anyone who's interested, kind of a breakdown from Dr. Massey, a letter he wrote, kind of a templated letter he wrote with his email address, talking about what we're doing at Vikor. And, it is vital during the time to remember that while COVID-19 is our most recent and urgent pathogen, there are other significant pathogens that cause hospitalization. The CDC is encouraging clinicians to test for other causes of respiratory illness in addition to COVID-19. So we did talk about a couple of the other tests that we offer. I mean, obviously the main goal of this is to talk about COVID-19, but some of our tests, particularly from the home care space, our urine and wound tests can be very, very popular. Because obviously if it's a complicated UTI or a nasty wound, everything is swab based. With a urine ID, you can just actually swab the urine. So patient urinates in a sterile cup, swab the urine, and we will test for 49 pathogens that cause UTIs and STIs. Our wound ID tests for 54 different pathogens. And then our gastro ID, which we are re-releasing soon, tests for, it's H. pylori, C. diff, rules out pathogenic IBS, very unique panels. And again, they're all swab-based, 99% accurate. These do automatically include the 49 antibiotic resistance genes, PharmD guidance, 24-hour turnaround time. This is everything that we test for on a urine ID. You'll see there's, almost anything and everything that can cause a UTI or STI is on here. Feel free to take a look at these, and then these do automatically bounce to the antibiotic resistance genes. And if you have any questions about these, obviously we can answer these at the end. Here's an example of our urine ID report. You'll kind of see this one was E. coli, lactobacillus. We did this had a resistance gene, and then our pharmacy guidance is actually on the report. So first line treatments, and then we typically offer 4 different treatment options for each one based on the pathogens detected, which is very helpful for providers. Obviously, we're not trying to tell anybody how to treat, but these are just pharmacy guidance options because we are fully integrated with the Sanford Guide, one of the first companies to be fully electronically integrated with the Sanford Guide. This is our wound panel. You'll see, again, extremely comprehensive of everything that we test for on a wound panel. Here's a sample wound report. So you'll see this staph was detected. There's a methicillin resistance gene, so that'll be MRSA. And then you see the notes from pharmacists, potential MRSA detected. And then obviously first line treatment options. This is just kind of a funny little picture. This is something that our traveling provider group is using. Basically just put all our stuff together in a kit, our FedEx packs, our urine cups, all our kits, had a folder put together, kind of a breakdown of who to reach out to, contact information. Those are toilet hats on top there. That's when we were doing our previous gastro IT panel. But just, for a traveling group, it's just kind of nice. Everything can be in your car. Everything can be just go with you, all pre-put together. So this is just a 60-second video. This is kind of nice to have out in the field if you or anyone on your team is wondering how to fill out requisitions, how to fill out paperwork, whatever it may be. We have a little 60-second video that can be texted or emailed. And this is just a training video on how to fill everything out correctly. Because again, if information is not filled out correctly, what's going to happen is it's going to get, kind of delayed turnaround time. And then we're going to have to fax you all the information. So I'll just I will play this video here. And again, it's just 60 seconds. And so then additionally, obviously, we provide contact information sheets. My name, Gene, is on here. Call, text our vice president, the number to the lab. If there's any missing info requested, who you can send it to, PharmD consults. Basically, what we're trying to do is really trying to make it so anyone out in the field, kind of traveling around, has access to everything: training videos, slides that have the kits, can do everything remotely and get your results in a timely fashion. So that is pretty much it in terms of going through the presentation. I will open it up to questions, but I really appreciate everyone taking the time.
Thank you so much, Adam. Again, reminder, if anyone has questions, you can type it into the questions box, which is in the side control panel that you have. We do have a couple at the moment. So the first thing is, who is qualified to facilitate these tests? RNs, LPNs?
Who's what? I'm sorry?
Who's qualified to facilitate these tests?
Who's to actually collect or to order them, like in terms of signing them? Because in terms of like doing the actual swab and collecting them, obviously that would be, you need to have the CDC recommended for the respirator, I should say. They need to have the proper PPE equipment, but to actually order the test, meaning send in the requisition, we do need the medical provider signature who has an MPI. But anyone can collect them. I mean, at offices, kind of doctors' offices and long-term care facilities, we do have MAs, CNAs actually doing the collection.
Great. And the next question.
LPMs, RNs, everybody. Oh, I'm sorry, go ahead.
No, you're okay. I'm just going to say the next question that we have is, has anyone managed these tests and billed privately?
Billed like to commercial insurance or private pay, like self-pay?
I'm not self-pay.
Yeah, so self-pay. So the Right now for the COVID-19 only that we're doing for employees, the private pay price is, I believe, $100. And then for all of our expanded panels, like the full respira, the full urine, the private pay price is $375.
Great. Do we have any other? Oh, okay. We have another one. How can a home care non-medical agency facilitate these tests for their caregivers?
So an agency, would this be maybe an agency that doesn't have an NPI provider but wants to test their employees?
Yes.
So they would need to find a provider or utilize a provider to get a signature on the requisition. I know that's kind of a vague answer, but there does need to be a provider signature. So if the agency is able to, I don't want to say hire one, but reach out to one, maybe one of the providers who looks at, maybe one of the doctors who looks after one of the patients as well, might be willing to sign for these. But obviously, that whoever the provider is, they are going to be getting the reports back. They're just doing COVID. There's not a whole lot to do with it. It's either positive or negative. If it's an expanded panel, obviously, that's why our tests. We really just started doing COVID-19 only just in the last few weeks. We've always been a company that is kind of geared towards the entire panel, looking at the whole picture and doing everything. And that's why there's kind of an MPI provider signature warranted, because obviously you can get results back with 6 pathogens present, with needing treatment options. But yes, a provider will need to be contacted and willing to sign for these tests. And well, from what we've seen for the COVID-19 only, providers are pretty open and pretty willing to sign off on ordering these tests for frontline workers and staff who are, obviously like the real heroes out there, treating these patients and testing these patients. So I think most providers will be open to that.
Great. And they said that makes complete sense. And so the next question is, how can a home care agency obtain these kits?
So yeah, so if you're interested in getting kits and having further conversations, hold on 1 second here. So we have our contact info right on the sheet here. I'll leave this up if you want to jot down my cell number, Gina's cell number, my email as well, and you can reach out to us, and we can have the discussion of how you want to get set up, because we do need some information again. And to set up the account, I should say, we do need an NPI. We do need a provider with their NPI to set up the account. So reach out to us so we can kind of discuss what that would look like. But there is no charge to the kits. Obviously, we do provide the kits no charge, and we ship them to wherever you need to go. But we can have those discussions.
Perfect. Do we have any other questions at this time? And while we're waiting, if we do have any other questions, Adam, do you have any final thoughts or words that you want to end us with today?
No, just I guess I know how busy everyone is. We appreciate you taking the time. I'm open to present this. If you have anyone else you think would be wanting to hear this presentation or wanting to go through this, Gene and I are both always available to present this to anyone or have discussions with anybody. We truly are open. We both work remotely right now, so we have plenty of time. So just let us know what we can do and how we can be a resource for you.
Great. Well, thank you again so much. A reminder that this was also recorded too, so I'll provide the recording information later on, once it's been processed. So thank you everyone for calling in and taking a listen. And Adam, thank you for doing this presentation for us. We really appreciate it. I hope everyone has
I'm happy to.
day.
Thank you.
Thank you.